Do therapy check in text messages have to be HIPAA compliant? If a therapist is sending check in text messages, they usually need to follow HIPAA rules if the messages include any protected health information like details about a patient's health or treatment. HIPAA requires that any communication involving PHI be secure and protected from unauthorized access. To stay compliant, therapists should use secure encrypted messaging platforms. This keeps patient information private and ensures it's handled according to the law. How often can healthcare providers send check in messages? The frequency of check in messages really depends on the type of care, the patient's needs, and the healthcare organization's policies. For primary care, you might get a message after a recent visit, once a year for a checkup, or more often if you have a chronic condition. For mental health services, therapists might check in weekly or every other week, especially if you need extra support. Post-surgery care often has daily or weekly check-ins in the weeks after surgery to make sure your recovery is on track. For chronic disease management, messages may come weekly or monthly to monitor progress and keep your treatment on track. If you're working with behavioral health programs, you might get daily or multiple messages each week for motivation and support. Specialists will send messages based on your treatment schedule. And finally, with preventative care, you can expect yearly reminders for vaccines, screenings, or wellness checkups. Key steps to ensure check-in text messages comply with HIPAA. Use secure messaging platforms like Powbox texting that encrypt messages so patient data stays safe. Get patient consent before sending texts and let them know what information might be included and how it will be kept secure. Limit sensitive information and avoid including private details about a patient's health. Train your staff about HIPAA rules and how to protect patient information. Set clear policies around texting, including what can be shared, how to verify the recipient, and what to do if there's a security issue. Check the messaging system often for any security problems. And finally, if you're using a messaging service, make sure they sign a business associate agreement to confirm they'll protect patient information too. What constitutes PHI in a text message? PHI in a text message can include any information that identifies a patient and relates to their health condition, treatment, or payment for healthcare services. Examples include the patient's name, diagnosis, treatment details, and appointment reminders. If a patient sends sensitive information via text, respond by acknowledging the receipt and directing them to a secure communication channel to discuss the details securely. You'll want to document the interaction appropriately. How to educate your patients about the security of text messaging. When educating patients about the security of text messaging, you'll want to provide them with information about the security measures in place for text messaging, including the use of encryption and the importance of keeping their devices secure. It's important to offer educational materials and discuss any concerns they may have.